our the webinar we're talking through and hanging out with about together for the next hour is called Menopause Masterclass. And so it's a little bit of a teaser into a lot of the information out there about menopause. I want to give a little bit of a background, touch on some key areas, and really spend a lot of time. I'm hoping to leave a lot of time for Q&A. We did receive a few questions via email from people who responded to some of the emails we sent out about this webinar. Happy to answer those. And if you have other questions for me, and I hope you do while we're going throughout this presentation, anytime you want to chat with other members, there is a button, this chat button that I have highlighted in the call here. That chat is a really great place to respond to questions I ask during the presentation, or if you want to chat with other webinar attendees. However, because it's really hard for me to hop into the chat while I'm live, there's just so many things going on with the presentation. It's kind of hard for me visually to hop back and forth in the chat. What I will do is that I request that you're going to use the Q&A button, which for most people, it's like a highlighted neon green in the center of your screen at the bottom there. That Q&A button, what that does, that collects all the questions for you, for me, that you send in. And then once I'm done with the presentation, I can see them all there. Whereas the chat, things kind of scroll by. It's hard for me to go back and find what questions you have in there. So any questions that come up that you would like me to ask at the end of the presentation, please add those into the Q&A, and then I'll be able to go through those, kind of scan through, and you can add them anytime as we go throughout. No problem to add them whenever they come up for you. Okay. And a tiny bit about me before we dive into the topic area. So my name is Dr. Jessica Bachman. I am the Director of Operations at Stronger You Nutrition. My academic background is that I have my PhD in nutrition with a concentration in exercise science, and I am a registered dietitian nutritionist. I worked in a hospital, a children's hospital down in Knoxville, Tennessee for a little while. While I was working on my PhD, I worked in the diabetes clinic and a weight management clinic, and with children with cystic fibrosis for a little while. And then I completed my research in behavioral weight loss interventions. So that's really my academic background, very much focused on the experience of women during weight loss during my PhD. I then worked in academia for a while and then was introduced to Stronger You first as a member myself. And so top right of the screen there is my transformation working with a Stronger You coach. I am a mother of two. And so after having my babies, I was still being really active. I was active in CrossFit at that time. I was lifting, I was running, but I really wasn't seeing any changes with my body composition. And so even though I knew all the information, I knew what I was supposed to be doing, I kind of understood in theory what I should be eating and the behaviors I should be following. It wasn't until I signed up with a coach where I actually applied those things, and I ate the protein I was supposed to eat, and I went to bed when I was supposed to go to bed, and made some changes in my life. So you'll see there, my personal transformation. I also used my Stronger You coach to run a marathon. I never was a runner, but I set that goal. I've also done strongman competitions, and so I've used the opportunity to have a coach to help me with fueling to achieve a lot of different goals in my life. And then for those that are on at the top of the hour, I did mention I'm also a high pointer, which to me, the high pointer goal that I have is to hike to the highest point in all 50 states. I've got 17 done. I should be heading up to New Hampshire and Maine 2 weeks from now, so I'll have 19 more. I do live in Pennsylvania, so I've done most of the high points in the Northeast. I have done Arizona, but I definitely have some more expensive and longer trips coming up soon to hit more of the high points out west, but looking forward to it. And those, I have my friend from Hawaii here, really excited to go there as well, but that's a big trip to plan for, of course. All right, enough about me. So let's go ahead and dive into the information tonight. One more plug I am going to mention quite a few times on this call is a course that I just developed with my team that specifically, this is a new way that Stronger You is trying to offer kind of expertise and ways of learning knowledge, and that's through courses. And so we have a course, a website now. And the first course that we created we called it Menopause Made Simple, Smart Nutrition and Lifestyle Tips for a Stronger You. At the end of this call too, we were going to show you that we do have a discount. The course is just being launched really as of today. No one has purchased it just yet. We finished up. It's amazing. It looks really, really helpful. And we would love for you, if that feels like a good way for you to gain some more information, to join our course. And we have a discount code to make that available for you at a little bit of a discounted price until June 9th. And so you will hear that the information that I cover tonight, this course is much more robust, but I tried to pull some pieces to give some background information, give you some helpful information tonight, just enough where you have some pieces to take home and really apply a little bit of the information from this course to your life. And then you will see how this course is also available if you want to go that direction as well. And the modules in this course, just to review, there's 6 different modules we have in this course. So first is understanding menopause. So it really goes into, the details of what is menopause, what's happening to your body during menopause. Second, during menopause, there's a big increase in risk for many chronic diseases. And specifically, there's 5 that we cover in a little bit more detail. And so talking about what's happening, why is disease risk increasing during this time period, and then a little bit about what are some things you can do about that. We know a lot of women have experiences where they're gaining weight during the menopause transition. And so we have an entire module about why weight gain happens, and then specifically what changes you can make to help support that not happening quite as much if that doesn't fit your goals. And then a heart of this program is what we're calling our Menopause Power Plan, which is 8 different key nutrition and lifestyle shifts. That there's so much information out there, but if you really focus on these 8 things, you will see such an impact on your symptom management, on your chronic disease risk, how you're feeling overall. And so we tried to boil down all that information to 8 key things to really focus on primarily. Then in Module 5, it gives some practical tips for how to actually apply those 8 different items into your lifestyle. And then 6 is really putting it all together like an activity to figure out what you're going to do when you walk away with this information. And so let's cover again, give some of the information from this call. So let's talk about menopause. What is menopause? Well, the exact definition of menopause is the moment in time when you've gone 12 consecutive months without a menstrual period. This, however, is not what most people think of when they think of the term menopause. Most of the time, people are referring to the entire menopause transition, which is more accurately described as 3 different phases: perimenopause, menopause, and then postmenopause. Perimenopause is a time period during this menopause transition that gets the most airtime because that's when you're having a lot of changes, you're feeling a lot of symptoms that are experienced for many, many women. It's the time period in which hormones will start to change and women will start to experience shifts in the regularity of their menstrual periods that eventually lead to that final one. It typically lasts about 8 to 10 years. So, yes, an entire decade of your life spent during this time period. It truly is refreshing that right now there are a lot more conversations about menopause. It's becoming more common, but it's still amazing how little research and how little airtime it's still getting compared to the length of time that women spend during this transition. Perimenopause often starts for women in their mid 40s, but it's not unheard of for symptoms to begin and to be present in mid to later 30s as well for some women. That would be earlier, but that definitely can happen as well. So on this slide, you'll see a comparison of some of the traits associated with the women's menstrual cycle that change over a lifetime. The premenopause time period is associated with females having lots of eggs, very predictable hormone levels, which produce regular menstrual cycles. This is the time period of peak fertility, right? From your first menstrual period, the time period where you're most fertile to become pregnant, have your babies. And then during perimenopause, what's happening there is that there are fewer eggs. There's very unpredictable hormone levels where sometimes things are regular and menstrual cycles are regular, and then other times they're irregular. And that's because hormones and cycle changes don't happen in a linear fashion. They're just not decreasing over time. It's much more bumpy in how those things happen. And so that's the reason, too, that if you're a female going through perimenopause, there's a lot of shifts in how your symptoms are appearing. Some months you might have them really strongly, and then the next week or next month you might not have anything at all. And that's because, again, the hormone shifts are not just literally dropping, it's changing and ebbing and flowing as you're going through this time period. Menopause, again, is the official end to the menstrual cycle. It's marked as a time when a woman has gone through 12 months without a menstrual cycle. The average age occurs at 51, and at this time, the ovaries cease to produce the sex hormones estrogen and progesterone anymore. So there's no more eggs being produced, and you start to have predictably low hormone levels. So there's less of that ebb and flow, it's low consistently. This is a marker of the end of a woman's childbearing potential. Menopause can be induced by some drugs, surgical removal of the ovaries, ovarian damage from cancer treatments, or other medical circumstances as well. And so not every woman is going to have the same experience. And then finally, postmenopause, that's the rest of a woman's life after menopause. Typically, most of the day-to-day symptoms that maybe you were experiencing during the perimenopause transition fade away over time. However, this is a time period where the risk for other more chronic diseases and conditions is increased. And so nutrition and lifestyle and behaviors are still very, very important. And those diseases include things like osteoporosis, heart disease. Those are increased during this postmenopausal period. Let's talk a little bit, again, just a brief introduction to some of the hormones that are really driving these changes. And predominantly, we're going to focus on those that are really the biggest impact for their change during menopause, which is estrogen and progesterone. So what do these hormones actually do? Well, estrogen plays a pivotal role in a woman's life through regulating menstrual cycles. It helps with preserving bone, helps to form serotonin, which has an impact on mood and sleep. It plays a role in the health of many organs and systems in your body. Estrogen is mainly produced by your ovaries, but it's also made in small amounts in the adrenal glands and in fat cells. And so even when your ovaries stop producing it, there's still some estrogen in your body from these other sources. Progesterone is also produced by the ovaries and is required to prepare your body for pregnancy. It plays a role in your menstrual cycle, it plays a role in your sex drive, it promotes feelings of calm, reduces anxiety, helps stabilize mood swings and irritability, and it's involved with a variety of other health systems as well. And so with the reduction of these two hormones, you can see that they can really drive a lot of the symptoms that women tend to experience during the menopause transition. So what are some of those common symptoms? So on this slide, you'll see some of the most common categories of symptoms that women experience during perimenopause. We'll talk just a little bit about each of those. And so first, the psychological symptoms, those include things like depression, anxiety, irritability, mood swings, or panic attacks. Sleep disturbances are very common for women, and that refers to both falling asleep as well as staying asleep. And then also the quality of the sleep overall while you are sleeping, all of those can be impacted commonly during this transition. There's a variety of musculoskeletal problems, such as joint and muscle pain and bone and muscle loss. There's vasomotor symptoms, which I feel are the ones that people really talk about with menopause, but they're really just a few of all the things that women experience. But those include things like hot flashes or night sweats. Many women experience gastrointestinal problems like acid reflux, constipation, diarrhea, bloating, and water retention. Weight change, as we mentioned, and unfortunately, women are typically gaining a lot of muscle. That's not the increase that women typically see. And so a lot of women report gaining on average 8 to 20 pounds during the menopause transition. And unfortunately, most of that is gains in fat mass overall. And specifically more centrally located fat mass, so around your midsection, which is associated with an increased risk for chronic conditions as well. A lot of women see issues with sexual dysfunction, such as vaginal changes, pelvic floor weaknesses, decreased libido. And then there's other symptoms like itchy skin and eyes, changes in taste, brittle nails. And so, again, you've likely heard of some of these, but some of them might be new to you. There's a lot of things that we're finding are associated with these changes that women are experiencing. For some women, they may not experience any of them. Some women really don't even notice they're going through the menopause transition. More likely, though, they'll experience at least some of these symptoms, but it varies widely. And again, the intensity, the frequency really varies with the changes and how the hormones are changing throughout this transition as well. They can come and they can go. And so for some women, they are really debilitating and it's so problematic, it's hard to function normally, where again, as others really don't have that same experience. And so overall, to know I am not a medical doctor, I have my PhD, and so I'm offering this as an overview of some of the options that are out there. And just as the symptoms vary, the treatment approaches also vary greatly based on each woman's needs and health status. And so this slide's meant to give a general overview of some of the options, but you really have to talk to your medical provider to figure out what is best for you. I'm not recommending either of these versus the other, just going to give some information on some of the topics that are really important to consider and have conversations about. First being hormone replacement therapy, which is really more appropriately called hormone therapy, can be really impactful for a lot of women. We do see that with hormone therapy, if you're on the right hormone therapy, can be associated with a reduction in some of the most common symptoms that can be really problematic for women, so you feel much better. It's also associated with reducing some of the increased risk for chronic conditions that are common, such as heart disease and osteoporosis, if you're on some of these hormone therapies. Um, they come in a variety of options, so you can get hormone therapy that can be delivered as gels, patches, pellets, creams, lots of variety out there. Another hormone that women may want to consider, because changes also happen with aging, to testosterone. And so that's something, just again, need to talk with your medical provider. But if you're experiencing things like high levels of fatigue, a lack of sex drive, impaired cognitive ability, those are things that may be associated with some changes in testosterone. Okay. And then there's also, hormone therapy. It's not appropriate for everyone. Some people are not interested in it. It's also maybe not safe for some people, especially those that have specific heart conditions. For many people, hormone therapy is a great option. If not, there are other things you can do as well. Thinking about still in the realm of prescription medication, there are pharmacotherapy options. So you can take medication to maybe help deal with some of the symptoms that are most problematic for you. And so things like antidepressants or sleep aids can be an option for you. There are a variety of herbs and adaptogens that have been used for many, many years, decades, to help control some symptoms too. Those you just have to be a little bit careful because they're just not regulated as much as pharmacotherapy would be, but there are some options out there that you might want to consider. There are supplements. And so if you're working with a physician, you're getting blood work and you're seeing that certain levels are low, taking a vitamin or mineral supplement to replace those levels can be really helpful. One of the items that we're not talking about as much tonight, but one of the items on our power plan is anti-inflammatory options. And so omega-3s are really important to reduce inflammation in your body. And that can sometimes be challenging to get in your diet alone. Absolutely you can, if you eat enough fish and eat enough of these fatty foods that have omega-3s in them. But many people who are following a traditional diet in the US won't come nearly getting enough omega-3s. And so that might be a good option for supplementation. And then cognitive behavioral therapy, a lot of the reports that women have for symptoms can possibly be helped by doing some therapy, right? By having someone to talk to, by working on a plan to feel better. And then finally, lifestyle change, which really is the area that I can claim to be most expert in, which are the things that we'll mostly focus on, for the rest of this call. There are behaviors, there are things you can eat, your nutrition, your physical activity, your sleep and stress habits that you can change that can make both your symptoms feel better and also reduce your risk for some of those chronic conditions that are increased during this time period. So during the menopause transition, as I mentioned a few times, and postmenopausally, we see some big shifts in risk for many chronic conditions in women. There's been quite a bit of research on chronic disease during this life stage, and what is absolutely clear is that we see an acceleration in risk factors and diagnosis of many conditions during this time period. What is less clear, however, is the root cause of why disease risk increases during this time period. There's still a lot to be discovered in this area. What we know currently is that increased risk for chronic conditions could be caused by many different things, and many of those fall into these three general categories. And so most likely, it's a combination of factors that fall into all three of these. So as we discussed previously, the menopause transition is triggered by a change in hormone levels in women, predominantly changes in estrogen and progesterone. And these hormones impact much more than just a woman's menstrual cycle and fertility. And there's a lot of hypotheses that some confirmed pathways that suggest that changes in these hormones are why we have an increased risk for many chronic conditions during this life stage. We also know that risk for chronic conditions tend to increase as we age. And so we see that increase in women who have gone through the menopause transition, but also in those who haven't yet gone through the transition. So there's something that happens with aging. We also see increase in risk in men. And so the aging timeline also causes this increased risk. And so it might not just be hormones, there might be other things happening that are different than the menopause transition hormone changes that happen during this time. And then finally, there's lots of changes that happen for women during this lifetime, during this life period that impact their chronic disease risk. And so this time period, that 40 to 60 age range, this midlife, is marked by caring for multiple generations of families potentially. And so oftentimes you're still raising your children, but you're also taking care of parents and older family members. They might need more support at this time. It may be a time period where your job responsibilities really reach their peak. It's kind of the peak of career time then. You might have a lot of things on your plate. And so all of these things can make it really challenging to find time to prioritize sleep, to reduce stress, to eat healthy, to be physically active. There's only so many hours in the day. And so a lot of times you end up being less active, end up not prioritizing these things that you know you should be doing that maybe had a little bit more time at least to prioritize in other stages of your life. And so it may be that lifestyle is the primary driver for changes in chronic disease risk during this time period. And so again, we know risk increases, around this age, but the actual cause is likely a combination of all of these factors. And so to review some of these conditions, the table has a lot of information here, but I'll walk through it a little bit for you. So these are 5 of the conditions that women are in increased risk for developing during the menopause transition. Those are weight gain and obesity, metabolic syndrome, heart disease, bone loss and osteoporosis, muscle loss and sarcopenia. And so in this table, you'll see the list of the conditions in the first column, and then each row gives some more information about each of those conditions. And so the second column shows you a little about what is actually changing during the menopause period. And then the last 2 columns talk about some of the factors that we can actually control that have an impact on our risk for those conditions. And so we'll talk through each of these conditions just in brief. Again, lots more information in the course is available if you want to hear more about each of them. But again, during menopause, it's very common for women to report gaining weight. Oftentimes, you'll hear women say things like, I haven't changed anything, but I just seem to keep gaining weight, or it's so much harder to lose weight these days. I do the same things I did in the past and can't lose weight anymore. Lots of interest in this topic area. Again, we don't know exactly what is going on, all of the details, but we do have information for things that women can do to prevent that from happening as much as possible. You can control the things that you can control. So women on average do gain about 8 to 20 pounds. And again, most of that gain is from fat, and it's fat mass that is more typically stored in the midsection. Metabolic syndrome, if you're not familiar, it's a summary measure of important cardiovascular disease and diabetes risk factors. So to be diagnosed, you must have 3 of the following. You must have excess weight, high triglyceride levels, low HDL cholesterol, which is the good cholesterol levels, elevated blood sugar, or high blood pressure. And women often develop components of that metabolic syndrome more commonly during the menopause transition and postmenopausally. I am going to do a little bit more of a deep dive onto heart disease on the next slide, since heart disease is the #1 killer of women. And so we'll go into a little bit more detail about that. To touch a little bit on bone mass. So bone mass tends to hit its peak around ages 35 to 40. So there is a normal small amount of bone loss that happens every year after that time period, whether or not menopause is a condition, is something you're going through. But we do see an acceleration of that bone loss during the menopause transition, as high as 10 to 20% decline during that 10-year period. Why does that happen during menopause? Well, estrogen has a protective effect against bone loss by slowing down the breakdown of bones. So our bones are actually active organs that are breaking down and being rebuilt regularly. And so that estrogen protects against the breakdown of bone. So when estrogen is lower, we tend to break down bone more quickly, and that puts you at higher risk for osteoporosis. And then finally, we also see an acceleration of involuntary, so not on purpose, muscle loss starting at the age of 30 in women as well. But that also increases how quickly you're losing muscle during the menopause transition. And so the good thing again is that while we can't control some of the risk factors, we can't change our body, we can't stop our body from reducing the amount of hormones it's producing during this transition. We do have control over a lot. Again, just to mention briefly, so as a reminder that hormone therapy is an option that can prevent some of these things from occurring, or at least reduce the amount that's happening. But on those, the last two columns, you'll see there are controllable factors too. And so the controllable factors, things like changing the types of foods you're eating, how much food you're eating, the physical activity that you're doing. And then the menopause power plan is again those 8 key items that we're going to ask you to focus on to really prioritize the most important things during the menopause transition. Those symbols kind of stand for each of the different items in that menopause power plan. So, just to go in a bit more detail about cardiovascular disease, since the leading cause of death in women, we do know that women have much lower risk for heart disease prior to the menopause transition, but that rapidly increases, and it increases to the amount where when we're younger, men have a much higher risk of heart disease. Our disease risk matches men after the menopause transition. And so, what are some of the things that are happening during the menopause transition that can explain this increased risk? Well, for one, we start to see higher levels of LDL cholesterol, which is your bad cholesterol. It's the cholesterol that tends to build up in your blood vessels. It's also associated with a higher risk of, again, those symptoms associated with metabolic syndrome, which can lead to things like thicker blood vessels with more plaque buildup. And when your blood vessels are thicker, they're more brittle, they're more susceptible to having plaque buildup in them, which can cause, increased risk for heart attack or stroke. We also find that HDL, which is the good cholesterol, it's the cholesterol that kind of pulls the cholesterol and the plaque away from your blood vessels and helps your body get rid of it. It loses some of its protective effects. And so even having high enough HDL levels, it's not working as efficiently postmenopausally. Some of those body comp changes that we talked about with increasing fat mass and reducing muscle mass also further elevates cardiovascular risk. And then one important note I want to make too is that if you are someone who is experiencing frequent or severe hot flashes, that's often tells you that there's some underlying vascular changes happening. Those are driven by changes to your blood vessels. So whether your arteries are getting thicker, there's more plaque buildup happening, and that can predict future high risk for heart attacks or stroke. And so if you are someone that's experiencing those quite often, make sure you are talking to your medical provider just so they're aware that you're experiencing those symptoms so they can make a plan that's most appropriate for you. And then to mention weight management a little bit, since I know that probably a lot of people on this call are curious about how you manage weight during the menopause transition. I think you'll both feel good in many ways, but also maybe a little bit frustrated in others that in general, managing weight during midlife and through the menopause transition really should not be much more different than what weight management techniques you use for the general population or for other periods in your life. What we know though is that there's just a lot less wiggle room because potentially, you're losing a little bit more muscle. Maybe your lifestyle is not allowing you to be as active, like your daily activity and time for walks or getting to the gym might be reduced. And there's a lot more wiggle room than if you're moving less, if you're burning less calories in your day-to-day activities to overeat. You might see that just going out to eat for one restaurant meal per weekend or having some wine in the evenings, those extra calories because you're moving less, you have less opportunity to do that without seeing weight change. And so it is different. I'm not going to say it's easy, but having solid nutrition, exercise, and following behavioral lifestyle habits that support weight management, it still works. And so I hope that feels empowering that you can still make changes. You just have to approach it a little bit differently though, based on this lifestyle. Um, and some things just to consider, I'm not recommending these, but there are options out there and available. And some of the symptoms that are addressed with some of these anti-obesity medications, so things like GLP-1 medications, the ways that they work can actually help improve some of the symptoms of menopause as well. And so for someone who is overweight and would like to lose weight, again, something to talk to your doctor about. Potentially, some of these anti-obesity medications, these weight loss medications could help with menopause symptoms as well as help making weight management more manageable for you. And again, hormone therapy or some of those non-hormone therapy options we talked about that help you reduce your symptoms, because if you're sleeping better, if you're not as irritable, you're feeling better overall, you're more likely to be able to choose healthy lifestyle behaviors. And so those things can help with weight management as well. Okay, and so as promised, I do want to introduce the items in our menopause power plan. And so these are the 8 key items. They're nutrition and lifestyle shifts that we recommend that you really focus on. And those are focusing on energy balance, which is the calories you consume versus the calories you burn, and the impact that has on many of the chronic conditions and on your symptoms you're experiencing. Protein, so a protein focused meal plan and diet overall can be really beneficial. We're going to go in more detail about fiber and about bone builders we recommend. In the course, we also talk about inflammation fighters, why hydration matters and what symptoms that can really help support you with, the importance of sleep and stress, and then strength and movement. And so those are the 8 items, and we're going to cover 2 of these in a little bit more detail on this call. So the first one to focus on is fiber. Fiber is so important. And so first, what is fiber? Fiber is a nutrient. Specifically, it's a carbohydrate that our bodies cannot digest. It's found naturally in many plant-based foods, such as fruits, vegetables, and whole grains. It comes in 2 types, soluble and insoluble, and our bodies need both of them. Soluble fiber, it dissolves in water, and what it does is it slows down digestion. And slowing down digestion allows for more stable blood sugars. It results in you feeling full for a longer period of time, which can help support weight management. And soluble fiber is found in foods like bananas, apples, beans, potatoes, and oats. You've likely seen the symbol on oatmeal for a heart healthy food, and that's where this comes from. Insoluble fiber is the cellulose type fiber. It's also called like the roughage in your food. This fiber holds onto water and it helps move food through your digestive system, and so helps reduce things like constipation. Insoluble fiber is found in berries, nuts, and whole grains. And because of its role in supporting stable blood sugars and managing appetite, fiber is associated with a reduced risk for weight gain, a reduced risk for cardiovascular disease, and for metabolic syndrome. We do know also that many women who are going through the menopause transition report having some GI related distress. So changes such as in bowel movements, bloating, constipation. Eating adequate fiber can really help reduce that. And so you want to aim for at least 25 grams per day. There is some research that suggests that aiming towards 30 to 40 grams per day may be even better. And so what are some tips for getting that much fiber in? I want you to make sure that when you're starting to introduce fiber, you do it in a way that feels easy to you, it becomes a part of your lifestyle, and is also comfortable. And so if you jump in too fast and start adding in all these really high fiber foods, you might end up being a little uncomfortable. It might cause some GI distress. And so recommendation first is to add fiber in slowly and also increase your water intake as you're increasing your fiber. Additionally, some tips on how to get 25 grams. Well, first one, if you're someone who drinks fruit juice, that has no fiber in it because you're taking out all the fibrous parts of the fruit by drinking juice. And so eat your whole fruit instead. That can be a big shift. Selecting whole grains instead of refined grains. Next time you go to the grocery store, look at some white bread versus some of the seedy, heavier breads there that you can actually like see the particles in there. Much more fiber in your whole grain sources versus your refined grains. Adding high fiber foods, so things like almonds, seeds, beans. I have a 25-gram protein, the ratio of proteins are 25 grams. I eat one of that with almonds on it. And so the yogurt itself has 0 grams of fiber, but I'm adding some almonds to it, which gives me some healthy fat and also fiber to that food. And so try and find ways to add more almond seeds and beans to your meals. As fruits and vegetables are a great fiber source, finding ways to not only include them in all of your meals, but also find ways to have fruits and vegetables as snacks. They're an easy on-the-go snack. They're so simple that I think sometimes people forget about them as an option, but go to the basics of having fruits and veggies as snacks. It's an easy way to get a lot in. And then if you're not able to get it in your food, I think many of you will be able to. I highly recommend you try and add your fruits and vegetables and whole grains to get it. If you can't, there are a lot of fiber supplements out there. You just mix into water, drink it down. That is an option if you're not able to get to that 25 grams. The note here in orange on the bottom, how do you know if you're getting enough fiber in? Well, you don't know unless you track it. And so tracking food and tracking intake, I know is something that some people love to do. They really thrive doing it. Others really, really don't. And so I do recommend though, if you're if you want to focus on fiber, if this is one of your major areas that you want to improve in, tracking it for at least a few days. And that could mean tracking all your food in something like the Stronger You app. We have a food tracker in there, or MyFitnessPal, Chronometer, or other options out there. You could track all of your food to see how much fiber you had, or you could just on a piece of paper as you're eating fiber foods, look them up and kind of calculate how much fiber is in there. But if you don't track it, you don't have the objective data and you're just like, I don't know, I think I'm eating enough, or I'm not sure. And so tracking allows you to be sure to know that you're hitting those goals. And then the second item I want to talk about in the of the 8 items in the power plan is bone builders. And so, as mentioned earlier, bone loss is something that accelerates during the menopause transition, especially during that last year before menopause. We see a big decrease in bone during that time period. And so, overall, the recommendation, you want to adopt a bone healthy lifestyle. And what does that include? Well, it includes making sure you're getting adequate amounts of some nutrients. So, specifically, calcium and vitamin D really have an impact on bone health. Also, being physically active, and so lifting weights and doing your cardiovascular activity, anything that causes pounding on the ground, so things like running or jumping, can really help with bone health. If you're someone who smokes, stopping smoking can be a really big improvement there. And then also limiting the alcohol that you drink can really, that's all part of a bone healthy lifestyle. And then just focus on the nutrients a little bit. So calcium, this is essential for bone health, muscle function, overall health. Side note that vitamin D helps your body absorb calcium. And so if you want to actually include and keep the calcium you're consuming in your diet, eating it alongside a source of vitamin D can be really helpful. Milk has both, right? Typical dairy milks are fortified with vitamin D and they have both. Note with calcium, it's much better if you can get it from food because a supplement is not recommended for everyone. It can actually cause some cardiovascular issues if you end up taking too much. And so you can easily overdo it with a supplement. And so where can you get calcium? You know, a lot of times people think of calcium only as dairy, and dairy is a great source. So low fat, fat free, full fat yogurts and milks are great options. But kefir, there's lactose-free versions, there's fortified non-dairy versions of milk products, so things like soy milks, almond milks, fortified with calcium. Vegetables, you know, some of your dark leafy green vegetables have quite a bit of calcium in there. It's a little bit harder to absorb that calcium. You can get some from that. Things like tofu, canned sardines, canned salmon, any of the fishes that have bones in there, the bones have calcium in them. And then there are a lot of products that are fortified with calcium now they're on the market. And so I always buy like orange juice for my house, which is for my son. I'd rather eat an orange. He drinks orange juice. I do get that is fortified with calcium. So it's a variety to think beyond just dairy products for your calcium intake. And the other nutrient really focus on for bone health is vitamin D. And the best source of vitamin D is getting vitamin D from the sun. And so our bodies, they produce vitamin D from cholesterol in our skin, gets converted into vitamin D when it's exposed to UVB rays. However, our bodies get less production out of our skin as we get older. And so you do need more vitamin D from other sources because our bodies aren't creating as much as we get older. And then if you live somewhere either very far north or very far south from the equator, you really can't get enough UVB radiation during the fall and winter months. And so vitamin D deficiency is one of the most common deficiencies across the globe because of those reasons. You can get vitamin D in food though, from egg yolks, dairy products, foods with added vitamin D. It's another one that gets fortified in many different foods. You can take a supplement as well. Definitely talk to your doctor, get a blood test, see what your vitamin D levels are, and you may have to take as much as like 2,000 IU's per day. There is research that shows that this really does matter, and they find that women with higher vitamin D status during menopause do tend to have less fractures later on in life. And a fracture later on in life can really impact your ability to do activities of daily living. So those are the 2 items from the Menopause Power Plan that we're going to cover tonight. And then just an overview, what we then do in the course, and what's really important whenever you're making behavior change or you want to try and add something or focus on your nutrition more, how do you do it? And how you do it is very, very important. And so these are 7 different things to consider, that can help you with integrating changes into your life. And so tracking what you're doing, tracking with intention. Again, it's not tracking your food forever, but doing it for a small period of time can be really helpful. Making a plan, thinking about your home food environment. So we tend to eat the things that are available in our house. We can't eat things that aren't available. And so if you don't keep the ice cream at home, you can't eat the ice cream at home. Not that you can never have it, you can go out and get it. But making your home food environment really supportive is very important. Doing some meal prep, it doesn't have to be, prepping every single food item you're going to eat for the week, but having some things ready and available for you can be really helpful. Developing sleep rituals that work is so important, reducing stress, and then finding a support group can be really impactful for making behavior change. And so, tiny bit more about my favorite item on that list, which is planning ahead. I think that that is just so important. It reduces stress if you have a plan on how to execute whatever it is you're trying to do. And so, specifically, if you're thinking about food items, planning ahead makes hitting your goals so much easier. It can look really different for every single person. There's a variety of ways that people choose to plan ahead for their food. But for some, it might be again planning out every single meal, prepping it, putting in containers that look lovely in your refrigerator. That is not me, but for me, planning ahead, I like to write out at least the dinners that I'm consuming for a full week on a whiteboard. What I then do with that information, I make my shopping list and I make sure that I have all those foods available. That way, after a busy day at work, running around with the kids, I come home and I know I have the foods available to make the healthy dinner that I planned. And so that to me is my source of planning ahead. Prepping some food in advance can be really helpful too. So for me, if I'm doing something like grilling on Sunday, rather than only grilling enough food for a Sunday dinner, I'll grill some extra chicken. That way I have it available for myself. And so thinking about things you can prep to make your meals easy to prepare during the school week. Scheduling exercise, if you are taking something like an Orange Theory class or a CrossFit class or any kind of group exercise class, when you can go online and book your classes for that week, go ahead and do them right away, because once things are booked, you're more likely to make it happen. If you're going to more of a traditional gym like an Anytime Fitness, Planet Fitness, still put those workouts into your calendar, because if you have it scheduled, you make it a priority. You're telling yourself, I'm going to prioritize getting my exercise in, and then you're more likely to do it. And then finally, scheduling sleep. I know on this call we didn't talk about the habits that can really help with sleep, but one of the most important things for sleep is setting the same bedtime and awake time every day. That gets your body into the cycle of sleeping well. And you tend to fall asleep more easily, stay asleep more easily when you're on that rhythm. And so scheduling your sleep and trying to be as non-negotiable about that as possible can be really, really impactful. All right, so that's the overview of the information. I want to now chat through just a few things of what we have available following this webinar for you. And then once I get through these, I'll have time to answer your questions. And so I haven't seen what is coming in. It looks like I have at least a few questions in the Q&A box. If anything else has come up for you, go ahead and add them into the Q&A and I will get to them in just a few minutes here. Happy to answer those. And so 3 different options I want to highlight if you want some more support in both increasing your knowledge to make changes yourself, or if you want support from an expert. These are 3 different things we have available. Again, new, we have some courses. We've offered this a little bit in the past, but now we're making it a more regular offering where you have a call with a coach. And then we also have one-on-one coaching options. So first, the first course that we made available is Menopause Made Simple, which is really a comprehensive self-guided course. It has videos, it has education, we have a companion guide that you print out, you answer questions, you leave with practical tools and an actual plan to apply the information from the course. And so the course is normally $45. Again, we're just launching that tonight. And so we're doing 10% off for the first week. We'd love for you to get that information. Give us feedback on what other courses you want, because this is something we really plan to make available. It's something that people have asked for in the past. We're really happy to make that available. The second option that we have, that we also have a discount for right now, is a 30-minute coaching call. So if you want some one-on-one time with a coach to get some of your specific questions answered, to get a plan to start you on the right track, this 30-minute call could be exactly what you're looking for. You talk to the coach, you fill out a form, give her information beforehand. Coach Eva will then get on a call with you, and then she'll email you a plan that helps you to get started on the right track. So these can be really, really helpful. And we do have a coupon code for that, special offer 10 for 10% off that call with Eva. And then the other thing, which is, the option I really like to recommend if you're ready for really making changes to committing to some goals right now, we have a team of coaches, many of which specialize in coaching during menopause. As a coaching team, we've done a lot of training and had a lot of conversations about that. And this is your personal one-on-one coach. And so you are assigned to a coach. You fill out a pretty intensive intake form so they get to know you. You'll have a phone call with them. And then you converse with that coach for as long as you stay with them. And so it's 24/7 access to our app where you can track your food, track your behaviors. You see summary information. Your coach reviews what's going on, and then they will make changes to the plan as needed. And so a really great option. You get access to our community as well, where you can share recipes, work with others. And so that community support is really helpful in your journey to change as well. And so we have an offer on here, coupon code special offer 25. You will get these coupon codes in an email too if you don't write them all down right now, which gives you 25% off your first month. I think we have I know I have some friends in the call right now that can put the website, if you're on your phone, I know it's hard to scan QR codes, but our strongeryou.com/services is where you can find all three of these different options. And so finally, just if you're curious why I recommend working with a coach, so especially if you're at a stage where you are ready to dive in and really make a change, it's because it works. Coaches really help you set up a plan. They keep you accountable to following your plan. And we all need support sometimes. That's one of the key things we focus on, the small changes, like really having friends, of course, are important, and surrounding yourself with people who are also making change or live the lifestyle you want to live can be really impactful. But there's nothing like having a coach. As I explained with my own experience, I knew all the stuff. I had all the information. I had my PhD at that time in nutrition, but I wasn't actually doing the things I needed to do until I had a coach helping me get there. And so big plug for Stronger You, because I love Stronger You, and I think our coaches do a fabulous job with making sure that you can get to your goals and making adjustments and being there along the way. So thank you so much. We have some time now for Q&A, so I'm going to stop sharing my screen. That way it's easier for me to see the Q&A. So let me just adjust what I'm looking at here. Hi, everyone. Oh, we still have lots of people on. Hello, hello. And if my friends can let me know, like I know Tracy, you're on, if there's anything that I missed in the chat, I'm just going to open up my text here. If you want to give me any info that came up, let me know. But I do have some questions here. Okay, so I'm going to go through the Q&A questions, and please still add more if those are coming up. Okay. All right, so first question, do macro requirements change in menopause besides higher protein intake? So really great question. This is obviously someone who has tracked macros before or has heard of macros before. So just a little bit of background in case that's a new term for anyone. Macronutrients are your carbohydrates, your protein, and your fat. And so those are the nutrients in our diet that provide us with calories that we're eating. They also provide a lot more than that. Do they change? Well, your macronutrients are how much you consume is dependent on how much energy your body is expending. And so the way you determine what your macronutrients are is you first determine what your energy intake should be. And so the total calories your body needs. That depends on a lot of different things, your lifestyle, how active you are, your age, your muscle mass. And so we do typically see that for women, again, during this life stage, for a lot of reasons, their overall calorie burn is less. And most of that's because their lifestyle has changed. They're not able to be as active. Even if maybe you're someone who's still getting to the gym, maybe you're not able to walk as much because, again, your life is just busier. That's personally been a huge shift for me. So I'm experiencing that life stage myself. I just don't have the time. Most of my time is spent running my kids around. I'm in the car a lot more. And so because of that reason, for many people, your energy needs are much lower during the menopause transition. It's not that your body comp is changing so much that you're burning way less calories. Although that happens a little bit, right? If you have less muscle, you are burning less calories. But in general, people are burning less calories because they're moving less, their lifestyle changes. And so, with that, if you're burning less calories, that means you need less calories to maintain your weight. And if you're someone who is trying to lose weight, that might mean you have to eat a little bit less than you ate previously because you are burning less calories. And so they do change because the overall volume is likely lower. That's not going to be for everyone. So if you've maintained your activity, if you've really focused on strength training and adequate protein, you've maintained your muscle mass, there is a way for sure to maintain your energy needs. Just for many people, I'd say the vast majority of women during the menopause transition, their energy needs are less. And so you do need to adjust them based on that information. All right, I hope that helped. Okay, just gonna click that one done. Okay. All right, this question, and I'm going to read it because I want you to know that I see it on here. I'm probably not going to be able to answer this one. It's definitely outside of my area of expertise. I would say that you're not the only person I've heard these from, so I would say they may be. But let me go ahead and read it, and then I am going to say I can't answer that question though. For the last year, I've been consistently getting vaginal infections. They linger for 6+ weeks and are difficult to clear up. I also have inflammation in my joints, fingers, foot, and knees, mostly when I wake up in the morning. Tests don't show inflammation. Is this perimenopausal? I just want to feel better. I don't know how to correct this going forward. And so again, I can't say that. That's definitely not my expertise, but I will say that there are definitely changes to the chemistry uh, of all of your sexual functioning. There is typically things are typically drier. I know the muscles change down there, and so I would not be surprised if there are also increased risks for infections or at least changes in risk because other things are changing there too. Same thing with some of the pain in joints. That's one of those things that I have more recently been introduced to as being a symptom of the menopause transition. And so I am not an expertise there, but I absolutely have read that that joint pain can be a symptom of perimenopause as well. And so talk to your doctor. I would say if, again, I don't know your age, but if you're in that timeline, I would say talk to your doctor, maybe get some blood work done to see where your hormone levels are. And if you're just going to your GP, some of them really know a lot about perimenopause and perimenopausal symptoms, some of them don't. So there are a lot of specialists out there too that may be able to, look at your blood work a little differently and give some other suggestions based on that. But I would say it's for sure outside of my expertise to say yes, definitely, but those are things that I've heard associated with perimenopause just in my research about perimenopause overall. Um, so yes, it could be. It definitely could be. Um, You talked about anti-obesity medications. What about peptides? AOD 9604, I think, is the one that helps with fat loss. So I would say that this is an area that I have started to dive into the world of peptides. I do not know enough about them because they're not nutrients, right? And really, at that point, they're medications and they're delivered um, through injections or pills. That is an area that I definitely do not feel comfortable commenting on because it's not my area of expertise. There's a lot of interesting information out there. This is definitely a newer area with many coming out there right now. I am just not the expert to talk about that. So I'm sorry. Anti-obesity medications, I do have a lot more, like GLP-1s, I have a lot more experience with, and I know a lot more, but I know I know the dietary impacts. I know how to help someone while they're on those medications. I still personally would never tell someone or recommend they go on them or don't go on them or which one to take. That's just definitely a medical provider that needs to make those recommendations. But for sure can help support people that are on GLP-1 medications because, and even the peptides, all of those, whatever you're doing has to be supported along with lifestyle change. And that is still challenging to do. The medications help a lot. They make it easier to make some changes, but you still have to work hard. You still have to make the right lifestyle changes. You still have to be active, eat the right foods. And so those are all there, but I really can't comment on specific peptides. Are there CEC credits for the Stronger You courses? No, so these courses are specifically meant for general population. And so they're not for like dietitians or people who are in the exercise science field to get CECs for a certification. Um, We do actually create courses like that. We are Stronger is partnered with Orange Theory Fitness and Anytime Fitness, and so we create courses to train coaches in those two different groups that are CEC approved. But the specific purpose of these courses are to help inform women who are wanting more information about the menopause transition. And so these courses are not CEC approved. If you are a member, if you're a coach at an Anytime Fitness or Orange Theory, we do have options available for that though. Okay. Is it realistic to lose weight postmenopausal without medicine and just nutrition and exercise? Yes, absolutely, absolutely. And so I personally have helped a lot of women do that. We have many coaches who have worked with hundreds of women through that transition. It's definitely possible for sure. And it ultimately, when you're losing weight, it's because you're making changes to your nutrition and your physical activity anyways. Anything else you're doing just supports it to be easier to do that. Like the medications, they help with a lot of different things, but one of the main things they do is they reduce your appetite. And so with anti-obesity medications, you're not eating as much because your appetite is reduced so much. Again, there's other things they're also doing, but that's the main mechanism for weight loss. And so you can, by doing things like eating a higher protein diet, by eating higher fiber, by consuming all of the water you need throughout the day, by being strategic with how you're eating and when you're eating, those things can help you feel more satisfied on fewer calories while still getting all the nutrients you need in. And that can absolutely help you lose weight because you're feeling satisfied, you're not starving, you're able to stick to your plan. Those things can help you get there. And then if you lift weights, especially heavy weights to help support maintaining your muscle mass, you can make sure you're maintaining muscle while losing body fat. That can absolutely happen. So don't give up. It just, again, like I mentioned, you have a little bit less wiggle room because you're just probably burning fewer calories because that happens with aging. That happens with being less active overall. But if you counteract that by going to the gym, by going for walks, by setting step goals, and then by eating appropriately to make you feel really good and comfortable on fewer calories with adequate nutrients still, you absolutely can get there. So I have no doubt um, if it feels like you've been struggling with that on your own, like if you would say that, yes, I'm definitely someone who's been struggling with that, I really highly recommend working with one of our coaches because that's specifically what they're there for. They're there to see what you're doing, assess what you're doing, and make recommendations to make things better, specifically to what your lifestyle needs. And so, would highly recommend one of our coaches for that. Oh, yeah, I see a comment in the chat just popped up. I'm 51, lost 20 pounds this past year with just diet and exercise. You absolutely can do it. So thank you for sharing that information. Yeah, great, great. Love that support. Besides heartburn, what other GI issues are seen during perimenopause? You definitely see changes. A lot of women report constipation. A lot of women can report, you said heartburn, so heartburn, bloating, and a little bit more gas too. So those are the most common GI ones that are seen during perimenopause, at least that I'm familiar with and I've come across. So yeah, heartburn, bloating, constipation are the main ones. Okay. Does creatine supplements have any benefit during menopause? I'm smiling because I keep saying I need to create a creatine to sell to people because I just talk about it so much and I really do believe in the benefits so much that I'm losing out on a lot of money by not pushing a specific creatine supplement because I do believe in it. I think it's a game changer for a lot of things. Now, it's not something you're going to take one day and feel better, but or feel totally different the next day or anything like that. But the research is so strong on the benefits of taking creatine, specifically creatine monohydrate. And there's a lot more research now too. Like the most of the research was previously on things related to sports performance. And with sports performance, predominantly with gaining muscle, right? So it allows you to how creatine works. It's basically this quick available source of energy when it's when it's creatine phosphate, it's a phosphate group that's removed from the creatine that creates a little burst of energy. And so anything that you require a burst of energy to do by having more creatine in your body, by saturating your body with it, you have more of that energy available. And so that's things like lifting heavy weights. And so it allows you to work harder at the gym to lift more weight. There's been a lot more research recently on the benefits of creatine monohydrate on things like reducing risk or improving like cognitive function. And so associated things with like Alzheimer's disease, a lot of benefits now, even with endurance training. And so it's a supplement that is well researched for a lot of things. It is very inexpensive, especially if you just do the powder. And so some of those gummies that are out there, they are way more expensive, and there is not as much research about how well your body can actually absorb them. But just the good old white powder in a big container, I just mix that in. So my yogurt I talked about earlier, my 25-gram ratio yogurt, I mix my scoop of creatine in that, and then I put my nuts on top, and that's a very filling snack that I have. And so I do recommend it. You know, I think it's something that everyone can really benefit from. We get creatine from things like red meat in our diet, but we don't tend to eat enough of the foods that have creatine to come anywhere near saturating the amount that our body can hold. And so taking a creatine monohydrate supplement can be very beneficial. Does question, does collagen actually help with bones, etc.? And so with collagen, collagen is a protein. It's a protein that is an incomplete protein. It doesn't have all of the amino acids. And so you wouldn't want to have collagen as like your main source of protein throughout the day, because you're going to miss some of the key amino acids. If you don't have all the amino acids, your body's not going to be able to use the amino acids for all that it does in your body, which is, you know, creating or the hormones in your body, building muscle mass. And so you want to make sure that most of the protein you're consuming is complete protein. Collagen is not that. And so what there is some, I would say, light research on is that collagen can have an impact on like hair, nails, skin. There is a little bit on that. And so I would say that if you want to include collagen, I don't say don't do it. I think it's fine to have that as like a once a day supplement to take. I just wouldn't count that as a main source of protein. And so there is some research that maybe it helps a little bit, but just don't make that like the protein supplement that you add all the time as a benefit for getting the protein your body needs in it. It's kind of an alternate supplement for things like hair and nails. Okay. I've been hearing that running can be problematic in perimenopause and can lead to increased belly fat. What's your view on walking versus running? So this is a very nuanced conversation. Running itself is not going to cause you to gain belly fat. So that just does not happen. It's not specifically to running. There's nothing that running does. What a lot of people do find, and you see a lot of people, if you don't pay attention to your diet, when you do something like training for a half marathon or training for a marathon, if you're running a lot, running does tend to increase appetite a lot. And so people end up then eating more food after a run, and they tend to eat more than what they burned. And so they feel very hungry from going for the run. And so a lot of people tend to gain weight when they're training for like a longer distance running. You also do see that with running, and really with any intense activity, when you do an intense activity like that, your body tends to move less throughout the day. So even things like, you guys couldn't see, the video had the top of my head. I talk with my hands a lot. And so you burn calories just moving your body around. And there's fascinating research that when you're doing things like running or intense activity, that if you do that in like one big shot, it's like all this activity at once, your body actually gets more still throughout the rest of the day. And so your body tends to hold on to that energy and not move as much. And so what that means is that a lot of people overeat in response to doing really high intensity activity, more so than what they're eating when they if they weren't running. And so a lot of the theory about people saying to walk instead of run is that walking doesn't have that same impact on appetite. If you're going out for like a leisurely stroll, you're not going to have that same appetite where you come back and you're super hungry afterwards. So walking is a great option. But running is also a great option. Running is really good for your cardiovascular health. You get your heart rate up. There's lots of reasons to run too, that you just don't get that same benefit from walking. And so it's nuanced. I think that maybe a little bit what you're talking here is maybe with cortisol levels. And so cortisol is a hormone that's released in response to stress. And so anytime your body is under stress, cortisol is released. But cortisol in itself, in response to like an acute, a short-term thing, like going for a run, yes, cortisol will increase during that time period, but then it comes back down afterwards. That's what cortisol is supposed to be. Cortisol is a problem when you're someone who's chronically stressed. And so if your cortisol levels are regularly high, cortisol tends to tell your body to store fat centrally. It's one of those hormones that increases and tells your body to store fat around your midsection. And so that's maybe where your question comes from. But running won't cause that. It's more that if you are not sleeping, if you are not controlling your stress, if your lifestyle is way too busy, but you're still getting in these long runs and you're also not eating enough food, that stresses your body. And then maybe you're overeating later on. Like there's all these other things that could potentially be leading to high cortisol levels. So it's not the running, but it might be the lifestyle surrounding if you're forcing yourself to get these runs in. And so there's a few different things that could be happening there, but it's not the running. Running's actually great for you. If you love to run, keep running. Whatever activity is that you love to do that can get your body moving is the activity you should absolutely focus on doing. And so it's not the running itself, it's kind of what happens in response to the running that you choose your lifestyle or what other things are happening in your life that really can have an impact on belly fat. It's a great question. I know that that's been coming up a ton, so thank you for asking that. Okay. Does following a primarily vegan diet make it more difficult to lose weight during menopause? I mean, yes, I'm only going to say yes because it is very challenging to get in adequate amounts of protein without eating too many calories on a vegan diet. Doesn't mean you can't do it, but you have to be very um, thoughtful about how you're choosing the foods that you can consume. I have been a vegan in my life. I did that for quite a while in college. I also did it again as like an experiment because I was working for a while. I mean, there are, of course, there's always a ton of vegans in the world. And then a lot of people, I forget that, I think it was Game Changers. I forget the name of the documentary that came out probably about 4 years ago about vegan athletes. And we had an increase in members coming to Stronger You that were on vegan diets. And so at that time, I was like, you know what? Let me try a vegan diet for 2 weeks. So I really want to see, can I hit these? You're welcome. Thank you, Linda. People saying goodbye right now. Thank you so much for joining us. And so I have a lot of members coming in that wanted to follow a vegan diet and wanted to lose weight. And I was like, okay, well, are the macros I'm prescribing, is the protein I'm prescribing helpful? Like, can they do that on a vegan diet? And so I did it for 2 weeks. I was able to do it. It was very, very hard. I had to eat so much food because, vegan sources of protein, things like mushrooms and soybeans, I ended up having 2 protein shakes per day, vegan protein shakes per day, because I was trying to hit 150 grams of protein per day, because that was what I was eating when I wasn't on a vegan diet. So my normal diet was that high, and I found I felt way, way better on that much protein. So it was hard, and I had to use a lot of like meat substitutes, which did impact my gut. So my gut didn't feel good because I was trying a bunch of new things. So that was my choice. I wanted to try all these new products, and so there are definitely ways. I used a lot of like the pea and yeah, so it's called. I think it was the Game Changer is what it was called. Um, Pea protein like pastas and black bean pasta. So I used that as an opportunity to try a bunch of new things, and so I think all those things have a ton of fiber too. So I did a lot of things for those 2 weeks. But I was able to do it. I was able to do 150 grams of protein, but I did have to really try hard. It's just more challenging, but you can do it. And so and I would highly recommend that you track your food because that's the best way to know what's going on. So specifically with like a vegan diet, try tracking what you're eating for 2 days, 3 days, even a full week, and kind of get a feel for how many calories you're consuming and how much protein you're getting in, and that will tell you, and if that's what you normally eat and you're not losing weight on that amount, that means you need to find a way to eat a little bit fewer calories, and so try reducing that, see how that feels. And so ultimately, yes, you absolutely can do it. There's just sometimes a little bit more challenging to get adequate protein while trying to lose weight with the vegan diet, but it's absolutely possible. Just a little bit more specific. We do have coaches that specifically work with vegan diets too. So again, if that's been something that's been a challenge for you for a while and you want some more support, we definitely have coaches. You write that on your intake form that you could for sure work with someone who specializes in that area. Next question, to lose weight and gain muscle, is it more effective to run or lift weight first? Uh, Really varies. So it's not going to be an always do this, always do that response to that question. Generally, what I would recommend is to lift first. Just being that to build muscle, right? You want to eat adequate amounts of protein, adequate amounts of calories overall, and you want to lift using the principle of progressive overload, which means lifting heavier weights. And so every time you go in, if you're doing the same thing all the time, you're not going to give your body the stimulus to gain more weight. And so you have to lift heavier weights. Now, if you go for a run and you get really tired, you may not be able to lift as heavy weights. So that's the reason I'm recommending that. Again, whatever works best for you, finding time to do both run and to lift weights is amazing. I commend you for doing that. Do what works best for your schedule. But if you have the choice, I would say do a little warm up, 5-10 minute warm up, get your body moving, then focus on lifting weights just so you're not tired, so you can lift heavier weights during that time period, and then go for your run is ideal. But let me say caveat, that's to maintain muscle, right? Now, if you're someone who's training for a 5K or half marathon, maybe running distance is your priority right now. I would do whatever your priority is first. If you're just someone who's trying to generally be healthy, I would say lift weights first because then you can still get both in, but you're able to lift heavier weights when you're not as tired. So I would do weightlifting first. Question. So I run, do strength training, sleep well, and eat very healthy, but I've started noticing belly fat. Is cortisol to blame? Should I stop drinking my morning coffee? So don't stop drinking your morning coffee. No way. I love coffee. There's definitely no research to suggest that drinking your morning coffee is at all related to belly fat. The only way that your morning coffee would be related to belly fat in any way is if you're adding a lot of cream and sugar to your morning coffee. And so ultimately, the first thing you want to look at for weight gain overall is the total amount of energy your body is consuming compared to the amount that you're burning. And so it sounds like you have a lot of really healthy habits, and saying eating very healthy, you could be eating, you are, I believe you're eating very healthy, but you can eat very healthy and still eat too many calories above what your body is burning. And if you're eating too many calories for what you're burning, you would be gaining weight. And so, what the cortisol response could be is that your weight, if you're eating too many calories, rather than distributing the body fat more throughout your body, which it may have done when you're younger, cortisol could be telling your body to gain more in your midsection, though. And so, but you can't gain fat if you don't have extra calories. And so, fat gain is really when you have too much energy, your body has to store it somewhere. And so, it stores it as body fat. And so, if you don't have extra energy to store somewhere, then you're not able to store it in your belly no matter what. So whether cortisol is high or low. And so first look at your overall energy balance comparison. So how much you're eating compared to how much you're burning. And again, it sounds like you have awesome habits, but it's very easy to eat more than you're burning. If you're not tracking what you're doing, kind of paying attention to that. So I would, again, for at least a few days, few weeks, track your food intake, see how much you're eating, and kind of track your weight a little bit, pay attention to those variables. Again, support of a coach can really help you get there. And it sounds like you are in such a healthy spot and probably could use just a little bit of extra support to get you to your goals. And so, working with a Stronger You coach could be really, really helpful for that. Do I take creatine before or after a workout? What's best? Either, any time of day. And so I just take it daily. That's what you want to do. And so for me, I always have it with my yogurt. I typically sometimes I have my yogurt for my breakfast. But sometimes I have it for my morning snack. And so as long as you're taking the 5 gram scoop every 24 hours, you're going to make sure you have it in your muscles in the amount that you need. And so the actual specific timing is not as important for creatine. It doesn't work that way. Once it's in your muscle and you have it saturate in your muscle, just keep doing it every 24 hours or so. A little flexibility there. Okay. At the end of the day, calories are king, protein is the queen. Would you agree? Yes, for many things. I mean, of course, the types of food I mean, so specifically, if you're talking about weight and body comp, yes. Of course, nutrients like fiber, your micronutrients, your vitamins, your minerals you get from fruits and vegetables, super important too. But as far as body weight change and body composition change, those are the two most important variables for sure. Calories, which is, total calories in and the total calories you're burning, that comparison there. And then protein is number two. So yes, Julie, absolutely agree with that. Is it true the first 20 minutes of cardio is only burning glucose, not fat? What order is best to do at Orange Theory? So no, your body is actually, you're always, so So this is going back to my exercise physiology background. So you're always burning both fat and carbohydrate. Like me sitting here right now, when you're not moving as much, you're actually burning more fat because fat takes more energy and takes more time to go from fat to actually producing energy that your body can use. And so when you're at periods of rest, when you're walking, things like that, you're going to be using more fat for energy. And that doesn't mean your body is burning body fat. It's fat that's already available to create energy in your body. You're going to use glucose primarily when you're doing things that are very, very high intensity, because when you're breaking down glucose and using glucose for energy, you can use glucose even when your body doesn't have oxygen available. And so I feel like I'm going a little bit off topic there to say that for your first 20 minutes of your cardio with RNC, you're going to be burning both. And the total amount of energy you're burning, whether it comes from burning fat or glucose, compared to the amount of energy you're consuming in your diet, is what's most important for weight loss. And so don't worry about the mechanics of what you're burning during the first 20 minutes of class at all. And then what order is best to do it? Orange theory, again, I personally like to lift first, and that's because for me, building muscle is the primary thing I want to do. And so if I lift first, and when people lift first, you're not going to be tired from having just done the run. You're not going to be out of breath after getting off the treadmill. And so whenever I have the choice, I do choose to lift first. And I think that's the best recommendation if you're someone that's just there for your overall general health and body composition. Like I would say lift weights first. And then because you're lifting your weights, that doesn't make you too tired to then run. Like there's not an impact, like the impact that cardio can have where you're a little bit exhausted, you're tired after doing that, you might not lift as much. You're sweaty, you're like, I'm not as comfortable. I need to take more water breaks. You just got off the treadmill. So I would recommend most of the time doing weight training first if that's an option, but it's not horrible to do the tread first too. So it's not hugely different, especially in the hour-long class. When you're not running, you're not going on like running for like a 2 hour run when you'd be absolutely exhausted. So really either is fine. But if you have the option, if the studio, has space in both, I would choose weight training first and then pick up those heavy weights, get some heavy weightlifting in, work really, really hard. All right, I see one more question here. As far as fiber, is an organic sourdough a good choice and also for digestion? Also, where are you from in Pennsylvania? So I am from, I live in Mountain Home between Scranton and Stroudsburg for 19 years. I am in Clark Summit, which is right a little bit north of Scranton, and then Stroudsburg. I drive down to Stroudsburg all the time because my son does travel soccer, and we tend to go down towards like the Philly area. We drive towards Stroudsburg often. So hi, fellow Pennsylvanian. Organic sourdough, a good choice for fiber and for digestion. I can definitely say yes for the fiber choice. So organic sourdough would be higher in fiber than your refined grains for sure. For digestion, that's also an area that my buddy Gianna, who's another RD that works with us, is definitely more familiar with. I do think with sourdough and the fermentation process that's used to produce sourdough, is likely more beneficial for digestion and gut health overall compared to other breads. But I do have to say that is not an area I'm an expert in at all. And so I would default to G if she was on this call to kind of talk about that. I believe that there is some recommendation towards sourdough for gut health and for digestion, but I don't feel comfortable saying yes, definitely to that. So, hello for fellow Pennsylvanian, though. Nice to see you on here. Okay, well, that is all the questions I see in the Q&A. I'm just going to run to the chat real quick here. I think we have mostly people saying goodbye and everyone saying hi up here, giving some additional information. Awesome, awesome. Okay. Well, with that, we are getting close to my bedtime because I am an early to bed, early to rise kind of person. Thank you so, so much for joining me tonight. There will be a follow-up email. I know some of my buddies were putting the information into the chat as well. There will be a follow-up email with a recording from tonight, as well as information about the sales that we're doing right now and your options for coaching, the call, the course. So thank you so, so much. I hope you guys learned some great information. Please let me know if you have any questions. Reach out to us. We'd love to work with you. Thank you all.